Well, good evening, everyone, and welcome to the Brian Crombie Radio Hour on Saga 960. I wanted to check back in with Roman Baber, who is the MPP for York Centre. He's a former lawyer. He is a former progressive conservative, but he left the caucus over some issues with Premier Doug Ford in regards to his handling of COVID-19 vaccine mandates, etc. And he's now sitting as an independent member of provincial parliament. Roman Baber, you've been pretty active on media and social media and everything of late. Tell us what you're up to.
Good to be with you, Brian. So it's been about 8 months since I have been expelled from the Progressive Conservative Caucus over my opposition to the lockdowns. If you remember, I have suggested that the harm from lockdown may be greater than the benefit from lockdown. And since then, I have continued my opposition to overreaching and what I would say very draconian government and public health prescriptions. Namely, I have grave concern with respect to passports and the employment mandates that are now resulting in potentially the termination of hundreds of thousands of Ontarians.
So, you take a look at what's happening in Saskatchewan or Alberta or the southern United States. Does that give you comfort or cause?
Of course, I have always acknowledged that COVID is a very serious infection and it requires our attention. And we are now very well familiar with this infection and what it tends to do. So for instance, on October the 15th, Statistics Canada came out with a report confirming that over 80% of all the folks that passed away regretfully from COVID are residents of long-term care homes. More than 80% of them are over the age of 80. So that tells me that what we need to do is we need to focus protection on those that are vulnerable from COVID and those that will potentially end up with bad outcomes, as opposed to subjecting the entire population to draconian measures. COVID is very, very serious, but we need to focus our protection to those that are at material risk of COVID as opposed to those that are not.
So that's the statistics in regards to mortality, and obviously that's terrible. It's probably one of the starkest negative things that have happened, stains on our healthcare system and our long-term care system that you could ever imagine.
It's important. If I may, Brian, to that very point, you're 100% correct. A couple of years later, we have yet to work out the long-term care system. And we know that the majority of the fatalities in long-term care resulted from poor infection protocol and control. And that resulted from the fact that there's inadequate staffing. So at a time when we are heading into the winter, when our healthcare system is already understaffed, at a time when our long-term care homes are already understaffed, does it make sense to let go, to fire further staff, thereby potentially exposing these patients to more harm?
But I presume that the reason why they had that 80% fatality rate was that they were exposed to either guests or workers that brought COVID-19 into their facility, and they were then infected by it. And after SARS, and you and I talked about this before, after SARS, there was actually a judicial commission that took a look at what happened in long-term care and said that one of the major problems was part-time contract employees that went from facility to facility to facility and carried the virus from facility to facility to facility. And frankly, what's happened, according to union people that I've interviewed since then, is the use of part-time contract workers has only increased, even though that judicial review recommended going with long-term salaried employees in long-term care to insulate long-term care facilities from each other. And lots of people have suggested that what you had was these non-unionized long-term care contract part-time employees that carried the virus around. And if they are unvaccinated and infected, they can do that all over again. And as we know, the vaccine may help you get better and fight off the infection, but it's not a shield. It doesn't stop you from being exposed to the infection or getting the infection. It only helps you fight off the infection. And so vulnerable people, and that's why they're recommending a third booster shot, I presume.
But neither does it stop the transmission of the virus.
Right. Of course it doesn't. The virus transmissions. And so therefore you got to stop the people that are transmitting it from interacting with people in long-term care facilities.
No, but if the virus doesn't stop transmission of the virus, it doesn't prevent folks that are vaccinated also from transmitting the virus. So we know that both vaccinated and the unvaccinated may transmit the virus. The vaccine was not meant to prevent transmission and does not prevent transmission. The only point of the vaccine was to greatly reduce bad outcomes. So I'm pro-vax and pro-choice. I'm vaccinated myself, and I invite everyone to get vaccinated to get the protection that the vaccine offers. It doesn't mean that we should force anyone to do anything against their will, especially when having folks vaccinate does not mean that they cannot transmit the virus. And
I think you're correct, but my understanding, and you're probably more knowledgeable on this, is that what the vaccine does is it obviously improves your immune system, so you kill off the virus more quickly. You don't get as sick, and so therefore the viral load is far lower, and so therefore the chance that you can actually transmit it goes down fairly dramatically.
That's a very important scientific point. With respect, I have to disagree with you. Dr. Fauci has been quoted multiple times saying that the viral load in the nose of those infected who are unvaccinated and those with breakthrough infections, meaning vaccinated, is the same. And I invite you to look at my Twitter account over the last couple of days in a member statement that I put out on Thursday, where I put a screenshot of that very article from CBS and multiple other sources. The viral load in the unvaccinated is the same as the viral load in the vaccinated. So it's
in the vaccinated that get breakthrough infections.
Yes.
So it's for the ones where the vaccine hasn't created enough of an immune response, which is a low percentage of all the people that have been vaccinated.
So we are seeing, for instance, we're now seeing in New York region that approximately a third of the cases are among the vaccinated. We also know that vaccine efficacy wanes after approximately 6 months. So we need to be very clear and very honest about the science. 6 to 8 months later, according to Pfizer, the vaccine wanes and the level of immunity goes down every couple of months. So we need to determine if we're going to become a society that makes people do things against their will, subjects people to breaching their bodily autonomy against their will, and a job loss is against someone's will, or being unable to participate in their favorite activity like playing hockey is against their will. And so we need to determine if we're ready to go there as a society when the benefit is trivial at best, given that those that are vaccinated also transmit the virus. But back to your original point, Brian. Yes, we still use labor agency work to go from a long-term home to another long-term home. Now, of course, I understand the union's position, and with all due respect to them, but the reason why it's happening is because we have a shortage of workers. We have a shortage of folks that are doing this kind of work. And now, by creating this mandate and purging further people out of the system, we're exposing long-term care residents to even worse conditions that they're currently exposed to. And that is unacceptable. We owe our elders dignity. I was at Dufferin Oaks a couple of days ago. I met with about 24 workers that are about to be let go. And they're saying we already have such a shortage that residents that are supposed to get 2 baths a week skip those baths. And by the way, we love them. We consider them to be our parents. And now we're being fired and we don't know who's going to care for these people. That is an unacceptable situation. Get vaccinated to get afforded the vaccine protection because it is very effective at promoting bad outcomes. But don't force other people to do anything against the will, thereby compromising the long-term care and the healthcare system.
We're chatting tonight with Roman Baber, the MPP for York Centre. He's been kicked out of the Conservative caucus, or was quite a while ago, because of his position on the government's strategies in regards to COVID-19. And we're having a good discussion tonight about some of his arguments. We're going to take a break for some messages and come back more with Roman in just a minute. Stay with us, everybody. Welcome back to the Brian Crombie Radio Hour on Saga 960. We're chatting tonight with Roman Baber. He is the MPP for York Centre. He's an independent MPP now. He was elected as a Conservative member of the Progressive Conservative Party, but he got kicked out by Premier Ford because he disagreed with some of the things that the Ford government was doing in regards to COVID-19. And he would argue favoring some draconian public health issues rather than the economic health of the province. And Roman, I wonder if we can come back to two of the issues that we were just chatting about. The first is this issue you talked about in regards to that vaccinated people can still get the infection and can transmit it, and you don't want people to be forced to do things against their will. In schools, we all had to get vaccinated for a whole bunch of different things. We have to get driver's licenses. We have to drive on the right-hand side of the road. We have to wear a seatbelt. We have to pay our income taxes. There's a whole bunch of things that we have to do in society that are against our will. And probably the most comparable one is getting vaccinated. But, take it to an extreme. There are a lot of studies that say that what ends up happening when people wear seatbelts is they feel actually more secure, and they then end up being more risky in their driving. And when there is an accident, the accidents are worse. And so some people think that actually wearing seatbelts makes accidents that do happen far more deadly, particularly for those that aren't wearing a seatbelt. So why is it that society can tell you to drive on the right-hand side of the road and you've got to obey? And drive within a certain maximum, and take and get your kids a whole bunch of vaccines before they go to school. And yet you think that this one issue is so different that we should allow people to do what they want.
Good question, although I don't think it's a fair comparison, and I don't think it's an intellectually honest comparison. Before I respond to that, I'd like to very quickly go back to the way you prefaced this segment, suggesting that I favored the economic well-being of the province over some of the public health measures set forth by the province when I opposed the lockdown in January. And Brian, with respect, that's also incorrect. My argument in my 2-page letter to the Premier was not even about jobs or the economy. Maybe one line was on jobs and the economy. My argument was on health and mental health, sir. Specifically, I argued that the mental health toll and the access to healthcare toll from the lockdowns will exceed that of COVID-19, generally speaking. 9 months later, and have proven to be correct without any shadow of a doubt. We know, for instance, that the increase in overdose alone in folks under age 65 is 3 times greater than everyone who passed away from COVID under age 65. We know that in Hamilton, for instance, we're seeing hospitalizations for attempted suicide among teens have tripled. We have seen a remarkable loss in our access to healthcare. About 275,000 surgeries, almost 300,000 surgeries were postponed in the province of Ontario because of the lockdown. According to QP Briefing, close to 1 million cancer screenings were postponed or canceled. 1 million cancer screenings less happened between March 2020 and March 2021. And when we talk about cancer screenings, we're not talking about random folks. We're talking about folks that are predisposed to cancer or at the age when they're looking for cancer. I speak to an ER physician who's a friend of mine who says that he's never diagnosed this much cancer in his ER, because typically you don't diagnose cancer in ER. And so we just had Breast Cancer Awareness Day. We had a record number of women missing their mammograms. So I think it's very, very important to appreciate the potential toll of COVID and to mitigate against COVID in the manner that I've discussed. Protect the risky settings like long-term care. Build hospital capacity, which we're still failing to build. We're doing the opposite. We're compromising healthcare capacity by firing healthcare workers. Tens of thousands of healthcare workers, according to the Premier, may be fired. And we need to be fair about the narrative, about where is the virus risky. So, with respect, sir, I never suggested that we need to put the health of the economy ahead of pandemic response. I said that we need to put the health and mental health of Ontarians from all other health and mental health causes, at least on par, or into the equation of the COVID risk. So having been a little long, I'll let you re-ask the question that you ended up.
Let's talk about that. So in Saskatchewan, this weekend, the Premier called in the federal army to help move people out of ICUs in Saskatchewan to Ontario. And the reason why was because of COVID-19 and the ICUs were filled. And he said it's not just to deal with COVID people, it's to deal with everything you're talking about, because he said, and it was interesting, he said that you move one COVID patient out of ICU, there's 18 other patients on average that can be dealt with, because the COVID patient takes up that much time in ICU because he's in ICU, he or she is in ICU that long. And so he was saying we need to free up ICU so that we can deal with the cancer patients, we can deal with the operations, we can deal with everything else that has to go to the ICU. And I have my own personal story. My mom went in for heart valve surgery, and she went into the pre-op and was all prepared. She arrived at like 7 o'clock in the morning, and 11 o'clock in the morning, they were said, there's not enough ICU capacity. We've got the operating room capacity, but the ICU capacity is completely filled with COVID patients. So we've got no one to take care of you once the operation is done. So you got to go home. So it wasn't caused by the lockdown. Both what's happening in Saskatchewan and what happened to my own mom was caused by too many COVID patients taking up the ICU capacity.
No, what's happening is that Canada has the lowest number of hospital beds in the developed world. Unfortunately, fortunately, the COVID pandemic has exposed the structural deficiencies in Canada's healthcare system. We had a province of 15 million people in Ontario paralyzed with 500 COVID patients. I read this morning that Manitoba's capacity is full. It has 40 COVID patients in ICU, and they're approaching their limit. And it's shameful that almost 2 years into this, we have not resituated ourselves, or adjusted ourselves to create that additional capacity. And when we talk about capacity, I want to be very clear. Space is not an issue. Doctors are also not an issue. Most of our ICU doctors are actually underemployed. The main issue is frontline healthcare staff and primarily nurses. We don't have nurses to staff those beds. And so the conversation has to surround around how we build additional capacity so we can adjust ourselves. Now,
no question. Okay, so let's stop on that again. So, and I saw the statistic, and again, I may be wrong, but something like comparing Alberta ICU beds to Texas, we have 5 times less per capita ICU beds in Alberta than they do in Texas. And so I think you're right in that regard, is that our hospital capacity, for whatever reason, particularly ICU beds, is dramatically less per capita than it is in other developed G7 countries. And so one very relevant question is, why is that? And why have we therefore, it would appear, underfunded our hospital construction fairly dramatically? That said, we're not going to be able to solve that right away. And given that it's a given, how many ICU beds we have, didn't we need to do the lockdowns so that we didn't fill them up with COVID patients?
Yeah, but the problem is the lockdowns are creating so many more. So no one has actually been able to show any efficacy of lockdowns, because you still have a ton of essential workers, you still have schools, you still have people going into long-term care, you still have essential workers going across the border. Locking down healthy people makes them sick, Brian. But back to the healthcare issue, capacity issue, well, we've been at this for almost 2 years, and we're just losing capacity. We're not gaining capacity, which is shameful. And we can take some concrete steps towards building capacity. For instance, Haldeman Norfolk is now offering $10,000 signing bonuses to nurses that will come and work there. What a novel idea. Pay people more to come and work. We can repeal Bill 124, Doug Ford government bill, which in fairness I voted for under a whip vote, which limits the pay increases for nurses by 1% a year. Well, how's that possible? We're seeing record level inflation in Canada. We're seeing the cost of basic goods go up 20, 30, 40%. I filled up my Jeep today. I paid $150 for gas. It's remarkable. And meanwhile, we're telling nurses whose pay is, $80,000 a year that next year their pay raise is going to be $600. This is shameful. This is absolutely shameful.
Okay, so I can agree with you completely. We need more
so
healthcare
one
workers.
minute.
We need more healthcare capacity. I agree with that.
So yeah, but by terms of healthcare capacity, we have 6,000 employees in the Ministry of Health, Ontario. We have more healthcare administrators in Ontario than doctors. We have an utter and complete mismanagement in Ontario's healthcare system. But locking people down or forcing people to do something to their body against their will is not going to get you out of the pickle that we're describing.
Well, so number one, you're arguing it won't get you out. I do think it'll get us out. But number two, you said it's against people's private rights to make their own decisions.
I didn't say it's private
rights. What about
rights.
Vaccines that we force all our kids to go to school to get?
Let's clarify that. No one forces anyone to do anything. First of all, one more time, I am pro-vax and I'm pro-choice. And I've taken the COVID-19 vaccine and I recommend to everyone to take the vaccine subject to any pre-existing conditions and subject to reasonable exemptions that their own physician acting reasonably may determine put them at risk. But subject to that, I encourage everyone to get vaccinated. Under the Immunization Pupils Act, kids actually have an exemption. You can do a parent signs an attestation, they attend an hour of class, and the student is exempt. But there's a remarkable difference between the MMRs, the mumps, the tuberculosis, and all the standard, and what we're dealing with here. And here's the difference, according to some parents. Number one, we had a lot more long-term trials on whatever we have done by way of the previous vaccination. Parents, I have reason to believe that the vaccine is safe and effective, but a lot of parents are saying typically it takes about 10 years to bring a vaccine to market, and I would like to maybe see a little bit more studies. That's not in a reasonable position. But there's a more important position that parents take in connection with this, is that mumps, tuberculosis, rubella, whatever we typically vaccinate children with, puts children in remarkable danger. And so the scientific evidence, the weight of the evidence makes it much more reasonable to vaccinate a child with the vaccination that we typically do. Conversely, we know that generally speaking, thankfully, kids are statistically at almost no risk for COVID-19. We saw a presentation today before the Board of Health, the Toronto Board of Health, by Kelly Brown, a money manager, who said that the rate of myocarditis among Ontario boys aged 12 to 17 is now approaching 1 in every 5,000. That's according to public health numbers. So a parent has to ask themselves, should I be potentially taking a risk with the vaccine? Because we know it's not without risk. And there's nothing wrong with calling it like it is. There is a risk of side effect. Compare that to the risk to my healthy child of COVID. And we know, again, thankfully, it's good to share good news. It's okay to share good news. That unlike mumps or tuberculosis, kids thankfully are almost no risk of COVID. You have to allow parents to make that choice. I'm not saying don't vaccinate children. Go ahead and vaccinate children. But don't make it impossible for parents to make the opposite choice by preventing a child from playing hockey, by preventing a child from going to the movies, by creating conditions where a child becomes a social pariah. At the very least, let's have a fair discussion. And that's what I've always been asking to do, Brian. We seem to be unable to have a civil conversation. We become demeaning to people. when we say that, well, you have to wear a seatbelt, or we always force them to do it, or you're a grandma killer, or whatever other names folks propose to make. Common sense has left the building, but most importantly, the scientific method has left the building. When it comes to children, we have to look, the traditional formula is, you look at the benefit, which is the reduction of the risk, versus the risk of the vax. And we need to potentially engage in that and give parents a choice.
Okay, but let's talk about kids then for a second. So number one, the children haven't been subject to vaccine until very recently, and the applications have just gone in. The approvals have just gone in to approve it for children under the age of whatever the age is. And the reason why is because child studies were done after the adult studies and have taken longer than the adult studies. And so we haven't been mandating vaccines for people under the age of the 12. And won't until we get Health Canada, FDA, et cetera, approvals of that.
I'm talking kids 12 to 17.
And there were studies of teenagers.
Yeah, there was one study. There was a study that studied 2,200 kids. That's it. A short-term study. It was either 4 or 6 months. I apologize that I don't remember that fact, of 2,200 kids. But now we're seeing.
While we haven't had long-term
excuse me, Brian,
studies,
we're seeing that the incidence of myocarditis, of adverse cardiac events among children aged 12 to 17 is now approaching 1 in 5,000. I invite you to listen to the presentation yesterday's presentation before the Toronto Board of Health. And this is Ontario, Public Health Ontario numbers.
And I also think the other thing that too often we focus on is only mortality, which is terrible. There's no question. But there's also other terrible issues with COVID-19. And to say that kids aren't at risk of getting COVID-19, I think is wrong. Kids
I didn't say that they're not at risk of getting COVID-19. I said that they're not at high risk for bad outcomes.
Right. So that's an important distinction.
Would you like to tell me what the statistics are for bad outcomes?
They're not high. You're quite right. But what they are is that there's a lot of people that are young or in middle ages that are getting sick. And that just recently we're getting more and more information in regards to long haul, and that the impact on the brain of people that are in ICU but recover is comparable to Alzheimer's on the brain. And,
Mr. Crombie, I would propose that you support your proposition with data. Long COVID in kids, as time goes on, we're seeing, thankfully, the data on long COVID subsiding. However, the data on adverse cardiac events is growing daily. At the very least, I would propose that I am content to put the evidence side by side. We'll share our screens and we'll do it. Because for far too long, we have been presupposing science. We have been demonizing people and making fun of them. And I have always urged a fair and reasonable conversation, which hopefully we'll get to soon.
So you're saying even if Health Canada approves vaccines for people under the age of 12, you would, because of the side effects, recommend against it?
No, I said that I would give parents the choice. I would not subject kids to mandates and passports. And I would definitely not, I generally think that you should not be forcing to make anyone do anything against their will. And of course, you may have an immunocompromised child, or you may have a child that may be predisposed to a worse outcome than another child. But at the end of the day, and so I'm in favor of doing whatever public health and whatever Health Canada recommends, but I'm not in favor of making parents do something that they might not want to do. Give them a choice.
And same thing for adults. You're saying that adults shouldn't be forced to take the vaccine.
Absolutely. Just think about what you're saying, Brian. You're saying that someone should be forced to take medication. We have never done that in the history of mankind. I can't think of that. And a disease that thankfully focuses on those with serious comorbidities and kills more than 80% of folks in long-term care homes is not cause to force to do people anything against their will.
Well, we're not forcing them to take it, but we're forcing them if they want to go to a hockey game to take it. If we want to go to a basketball to take it, if they're working in long-term care or in potentially hospitals where they're exposed to people that are vulnerable to take it.
We have been through this. The vaccine doesn't prevent transmission. So I'm not exactly sure what you're accomplishing there. But Brian, when you force someone to do something on the condition of being able to put food on the table, to me, that is forcing them.
We're chatting with Roman Baber tonight, the MPP for York Centre, who is a very eloquent, articulate arguer for his position that not many people agree with, but some people do. And he's making a lot of noise and having an impact. Roman Baber, thank you so much for joining us and sharing with us your views.
Good to be with you, Brian.
We're going to take a break and come back more in just a minute. Stay with us, everybody.